Firstly, I want to thank Deputy Shortall and Murphy and colleagues for raising this, tabling this motion, and I do think it's a really welcome opportunity to discuss what you have set out in the motion. And you are quite right, every 3 minutes somebody gets that call. Unfortunately, we were one of the families that got that call 15 months ago. My husband was diagnosed with cancer, but thankfully he has come through it so far. And I do understand exactly, the issues that you're raising, and I'm actually surprised that we're here alone discussing this. I'll be honest with you. I lost my own dad in 1995 to cancer, and I currently have an uncle having radiotherapy today. So there's not a family in Ireland that hasn't been closely affected, and sometimes some families seem to travel that road a lot, but I don't think there's any family will ever escape it. And I do welcome this debate. Before continuing, Minister Donnelly has asked me to express his thanks to the Irish Cancer Society, who have played such a vital role in helping to transform the experiences and outcomes of people affected by cancer through their tireless work. This includes research such as the Real Cost of Cancer report. I am sure this is something the whole House can agree on. Minister Donnelly looks forward to continuing to work closely with the Society to further develop cancer care services and supports in the years ahead. The opening line section of the motion is sobering, and it highlights the challenges we face today. It is true that around 24,000 people are diagnosed with invasive cancer in Ireland each year, excluding the common but rarely fatal non-melanoma skin cancer. And the reality is that the overall number of cancers diagnosed has continued to increase due to our increasing and ageing population. This underlines the importance of delivering on the National Cancer Strategy 2017 to 2026, with its focus on cancer prevention, diagnosis, treatment and patient supports. The vision of that strategy is that together we will strive to prevent cancer and work to improve the treatment, health and well-being, experiences and outcomes of those living with and beyond cancer. It is about preventing cancer across our population, diagnosing cancer early, providing optimal care to people and maximising their quality of life. The strategy provides a comprehensive 10-year roadmap for cancer services, and we have seen significant progress on its implementation over the past 4 years. Clear, evidence-based policy direction from the Department of Health and strong implementation by the HSE's National Cancer Control Programme has resulted in real improvements across all stages of the cancer continuum. We have the evidence to show that this approach is working. The most recent annual report published by the National Cancer Registry shows that the incidence of cancer per 100,000 people has fallen or at least stabilised in recent years, and survival rates for cancer patients are continuing to improve. 5-year net survival for patients diagnosed during 2014 to 18 averaged 65%, up from 42% from those diagnosed during 1994 and 1999. As the deputies note in their motion, an estimated 200,000 people are living with and beyond cancer in Ireland today, thanks to continued improvements in medical oncology, radiation oncology and surgical oncology services. However, we must recognise that the National Cancer Strategy is not concerned solely with advances in treatment, but also on improving the quality of life for those living with cancer. This is why the establishment and ongoing work of the Cancer Patient Advisory Committee is so important, and why there is also a focus on providing grant funding and best practice guidelines for community cancer support centres and developing survivorship services to support those living with and beyond cancer. And I think of the Solis Centre in Waterford today. Deputy Cullinan will be very familiar with it also, and it absolutely offers great support and services to people living with cancer and going through treatment. Such progress has only been possible thanks to the very significant government investment in cancer services in recent years. Over budgets 21 and 22, some €97 million in additional funding was allocated to cancer services, of which €40 million was allocated specifically for the continued implementation of the National Cancer Strategy, building on the progress and momentum to date. A further €30 million was provided for new cancer drugs, while €12 million was set aside for screening services, and the remainder was used to ensure that cancer services continue to recover from the disruption caused by COVID-19. I think it is important to set out for the House the extent of the Government's investment in cancer services in both financial and policy terms, in order to clearly demonstrate our deep commitment to supporting many thousands of people and their families and carers who are living with cancer in Ireland today. Nonetheless, despite the investments in our cancer services, the Minister for Health is acutely aware of the financial difficulties that people can face following a cancer diagnosis. It is true that cancer can place a financial burden on some individuals and their families through the combined impact of loss of income and additional costs associated with their treatment. This issue is not confined to cancer patients, and individuals diagnosed with other long-term illnesses may also have to cope with financial stresses as a result of being unwell. It is for this reason that support to ameliorate the costs of illness should be available to all, rather than focused on those with particular conditions. This is the principle behind the transition to universal healthcare envisaged by Sláintecare, where people access the right services based on need and not ability to pay. In relation to inpatient health charges, under the Health Act 1970 as amended, all persons, irrespective of illness or condition, accessing public inpatient, including day case service in a public hospital, are liable for the statutory inpatient daily charge, which is capped at a maximum of €800 in any period of 12 consecutive months. There are, however, exemptions from these charges for identified groups of people, including but not limited to people with full eligibility, that is, medical card holders. As is the case for all patients, cancer patients can apply for a range of supports, including medical cards, and they are assessed under the criteria applying to all applicants. Every effort is made by the HSE within the framework of the legislation to support applicants in applying for a medical card, and in particular to take full account of the difficult circumstances in the case of applicants who may be in excess of the income guidelines. Indeed, the Irish Cancer Society found that over 80% of those diagnosed with cancer who apply for a medical card are successful, while medical cards are awarded without a financial assessment to all children under 18 years of age with a diagnosis of cancer for a period of 5 years. Individuals with a terminal illness who have been certified by their treating consultant as having a prognosis of 24 months or less to live are also now eligible for a medical card without a means assessment, and I know everybody has welcomed that. Beyond this, the HSE has discretion to reduce or waive inpatient charges in cases of excessive hardship, while in certain circumstances the HSE may grant a medical card even though an applicant exceeds the income threshold, where they face difficult financial circumstances such as extra costs arising from an illness. Of course, further supports are available to individuals, including those provided by the Department of Social Protection. All patients require a responsive and compassionate health system to meet their medical needs. I believe that is the underlying intent of the Deputy's motion, and it is why the Government is continuing to work towards the terms of delivering an affordable, accessible and quality health service for all. As such, the Government does not intend to table a counter-motion. My colleague Minister Rabbitte will discuss progress being made on affordability later in the debate, as well as addressing some of the other issues raised by the deputies in the motion.